The topic I chose for my final presentation is the importance of imagery in recovery. The purpose of this presentation is to explain how student athletes can benefit from imagery when in the rehabilitation phase of their recovery. I have chosen to focus on ACL injuries. My target audience will be coaches, so they can gain knowledge on ways to help their athlete recover mentally as well as physically. This will also allow coaches to be more involved in their athletes' recovery and understand how they are feeling. So, what is imagery? Imagery involves our imagination in a therapeutic manner. Phrases and words are used to evoke our senses to allow us to picture what is being described. It is a process that encourages healing of the mind, body, and spirit. It is also a form of relaxation. How does it work? With the use of phrases and words, the images we create become real events to our body through the engagement of as many senses as possible. Once in control of our thoughts, we are able to apply our imagination to create more intense healing and growth. Imagery really only works when we are fully focused and in an environment which is stable and free from stressors and distractions. Next, we have some benefits of imagery for the individual. To list a few, it facilitates the speed of recovery and athletes' ability to cope with injuries. It enables the athlete to become closer to their injury. Therefore, they can visualize each muscle or bone that could be affected and what they are needing to do during rehab. For example, contracting a certain muscle, understanding how the muscle should move and what the movement should feel like. Another benefit is that it also improves positive self-talk and motivation. Imagery focuses on the positives and the outcome rather than the negatives of missing out on playing, increasing the motivation of the athlete by allowing them to see the progress they are making. Finally, prepares the athlete for a return to play both physically and psychologically. There are many forms of imagery. The first is healing imagery. Relating to ACL injury, this is when you see your knee starting to heal, focusing on the muscles and the sensations of your body getting stronger and back to full range of motion. Next, pain management imagery. This is when you create the image of your body free from pain. There are 3 parts to this type of imagery: pleasant imagery, pain acknowledgement, and dramatized coping. Pleasant imagery is visualizing yourself in a comfortable and relaxed setting. This could be a beach, for example. Pain acknowledgement is when you assign pain physical properties, for example, the size, shape, color, sound, or feeling of the pain. And finally, dramatized coping. This is when you flip the pain you may be feeling into motivation. Next, rehabilitation imagery. During rehab, you may face many challenges and you need ways to deal with them. So your self-efficacy needs to be high in order for you to overcome any setbacks you might face and staying focused to finish the exercise and rehab session. Self-efficacy is that if you believe that you can get through the rehab, you are more likely to succeed. And finally, performance imagery. This is the mental rehearsal of the sport-specific skill. By getting them involved with their sport and engaging in the senses, it can help to reduce anxiety and stress as they are back visualizing themselves playing. Often, an athlete needs to play their sport to help reduce any stress they may be feeling. So if someone has an injury, this imagery can help to place them back on the floor and help to relax them. For imagery to be most successful, vivid images need to be created. For this to happen, the athlete needs to have control over their thoughts and emotions. A simple way for the athlete to have control is for them to be in an environment that makes the athlete feel comfortable, relaxed, and confident, that will allow them to focus on the imagery rather than their injury. Another thing they can do is relaxation techniques, such as deep breathing. This will allow the athlete to center their thoughts and slow the heart rate so they are ready to focus on creating their images. Another great way to create vivid images is by including as many of the senses into the phrases and words you are using to describe the scenario and place them in the environment of their sport. For example, in basketball, I would say things such as, you are out on the court. You hear the squeaks of the shoes on the floor. Your opponent is staring at you with the ball. Sweat dripping down your face as you take the shot. Jumping in the air, you release the ball off your fingers and see it go through the hoop. The sound of the net as it swishes, and you land safely. Language and choice of words is key. Always try to keep it positive, as this will allow the athlete to feel more comfortable and aid healing. My choice of words in the scenario involves senses of sight, sound, and touch to give a detailed description of a play that may constantly repeat in the athlete's mind. Okay, so what is an ACL injury? It is your anterior cruciate ligament, band of tissue in your knee connecting your femur or thigh bone to your shin bone. When you have an ACL injury, you either tear or sprain this tissue in your knee. This type of injury is most common in females due to their genetic makeup of hip positioning and hormones making impactful sports such as basketball, soccer, skiing, and tennis a higher risk of this injury occurring. However, males are also likely to suffer from ACL injuries. A research study I found, conducted by Deborah Kupel from Utah State University, examined the effects of relaxation and guided imagery on knee strength, re-injury anxiety, and pain for ACL patients. The idea of the study was to have 30 participants split into 3 clinical trials of either receiving 10 relaxation and guided imagery sessions for the treatment group. Group 2 was given attention, encouragement, and support. This was named the placebo group, or the control group was given nothing at all. This study was conducted over 6 months, with 10 sessions being given every 2 weeks to each individual in the treatment group, alongside their normal physical therapy. The sessions were to focus on the psychological processes happening at each stage of recovery, while accommodating perceptions by promoting positive emotional responses and using varied imagery modalities such as internal, visual, and kinesthetic imagery to improve the vividness of their imagery. The results showed that over the 3 areas of knee strength, re-injury anxiety, and pain, that the treatment group showed support for imagery. The individuals showed greater knee strength, less injury anxiety, and significantly less pain. When deciding what imagery to use and how the athlete is best going to cope with the imagery, you can use the Sport Imagery Ability Questionnaire. This is used to assess the ability of the athlete to imagine different content and how easy or hard it was to picture. It is a set of 15 statements and you have to answer on a 7 Likert scale. 1 being very hard and 7 being very easy to imagine. You can either gather data on 5 subscales of image ability, which involve skill, strategy, goal, effective, and mastery imagery abilities, or an overall global measure which takes into account the average score. By doing this before you start imagery with an athlete, you will be able to gauge where they are in terms of imagery ability and what areas you can focus on. When given imagery, it is important to keep the imagery script relevant to the part of the rehabilitation process they are in. For example, at the beginning of an ACL program, the first 3 weeks is often mentally and physically draining. It involves a lot of focus on the muscle activation of the quadriceps. Due to this, imagery should be specific to engagement of muscles. For example, you could highlight the VMO muscle and focus on the tightening and relaxation of the muscles one at a time. This type of imagery can be given before or during the rehab, as it will benefit through both. After rehab, you can always give healing imagery scripts. For example, for every deep breath, you are transporting important oxygen to your knee, aiding the muscles. When they become more active and start to run and jump, the imagery will be focusing on their performance. Therefore, performance imagery, you will have to highlight things such as equal weight distribution when jumping and landing, focusing on the technique of running and getting your legs and knees to move as naturally as possible. Finally, I gathered some opinions from athletes here at Barry that have either gone through or are going through their ACL rehabilitation. These were from female athletes, both basketball and soccer. They were saying that it was a great way to give an athlete confidence. If it can be implemented into practice and game scenarios, then they think it will be beneficial. However, one person did say that they wouldn't feel like they could fully let themselves go, opening up to their coach. However, if their coach understands imagery and gets taught alongside their sports psych, they would have benefit to the athlete themselves, as they can relate to the court and they'll think it will be a good idea. Finally, I have my references that I used, and I have it open for any questions.